I'm Kelsea Green. It's so lovely to properly meet you, even if it's by a screen. And it's lovely to be speaking to a fellow Australian in this space. Um, but yes, today's topic is Chew Daily for Optimal Development, and it is the final of our series. So I'm joined today by Dr Shereen Lim, who is a Perth-based dentist with a postgraduate diploma in dental sleep medicine from the University of Western Australia. Since 2011, she's been involved in the multidisciplinary management of snoring and obstructive sleep apnea. And her early clinical work was in adult sleep disordered breathing, which sparked that deeper interest into how healthier jaw development and airway function earlier in life might minimise these problems later in life. So today the focus is on children's airway health, and the clinical work centres around tongue tie management from infancy, which is so important. She's also the author of one of the best books around, in my opinion, Breathe, Sleep and Thrive, a book exploring how breathing and oral development influence children's growth, learning and overall well-being. I know it's a staple in my clinic, and it's one I recommend to parents all the time. So I'm very excited to be joined today. So hello and welcome, Dr. Lim.
Yeah, thanks very much. Can you hear me okay?
Yes, can. Yep, all good. Amazing. So can you briefly share what led you, I touched on it a little bit, but into functional dentistry and then airway focused care for children?
Yeah, really my interest in sleep and airway began with my husband snoring. It was driving me pretty crazy. So I got out of bed one night, decided to research about dental sleep appliances, how they could be worn overnight to help open up the airway and alleviate snoring. And I decided I was going to help more spouses in this boat. And so that's when I decided to enroll in a graduate diploma in dental sleep medicine. But during the course of that program, I started to come across research that said early intervention with palate expansion could help alleviate obstructive sleep apnea in children. And I wanted to know if we're doing a Band-Aid solution to compensate for poor jaw development, how come we can't grow the jaws properly in the first place? So that's what got me interested in interceptive orthodontics. But Dr. Christian Gimeno, he's like, form follows function. You've really got to pay attention to the oral dysfunction early in life that contributes to poor jaw development. And so that's where my interest has become. How can we address root causes to help minimize problems later on in life, but also help children thrive better in the process?
Yeah, amazing. And it is, I think that's where almost we all, well, I know my caseload, I've tried to get younger and younger because it's like we can do more in that early phase, and why we created a series like this in the Munchee spaces too. Like the more we can do and educate parents from the very start, it's a game changer. And you'll often, as a parent, sit there ticking those boxes of yourself and go, oh, could I do better with the next generation? I know that's personally where I'm at. I look at my partner's mouth and go, and mine, but particularly his, and what can we do differently with our kids?
Yeah.
So we're really focusing in on the chewing, and I know we could talk all day about all your incredible work around tongue ties and things, but focusing in on chewing, why is daily chewing important for healthy jaw and airway development in children, and what tools and strategies do you use or recommend?
Yeah, well, chewing, it's one of the best ways beyond breastfeeding. It's the next way, and nasal breathing, to stimulate all the muscles to work really well. And when we get the muscles working well, that's what drives that good jaw development. So how do we get it? Chewing, I think that Munchee is a really critical tool in our practice. We're a dental practice. We're not watching children feed and eat, but I offer that Munchee as an option for nearly all my patients who I'm beginning orthodontic treatment on. I just want them to practice chewing with both sides of their mouth. A lot of children really struggle to get up to that 10 minutes of that lip seal. So having the Munchee is a really great way to get them to chew, but to also monitor their progress and how well they're chewing.
Yeah, no, definitely. And use like any other strategies? So I love, like, Munchee's our key one, obviously, Munchee team, but also in clinical. Any other strategies or quick tips for parents?
I believe in, I'm on board with baby-led weaning. So, when weaning children onto solids, rather than overdoing purees and the pouch foods to encourage parents to do baby-led weaning or to offer finger foods, just the same meals as everyone may be able to have.
Yeah.
I personally am not really involved in educating patients, but I know yesterday I had a parent come in and she'd been working with a team, and she said they've been more conscious about chewing in front of the mirror and closing his mouth. And she said, look, that is a game changer. If I do nothing else but this, it really changed our son's trajectory in life.
Yeah.
So,
Yeah,
yeah.
so simple, really, but that's great. That's a
Yes.
really good one.
Yeah.
So I can just say, if you comment 2 today, you can access the guide on why children must chew. And it's just a good one. It has a few strategies and information about like what we're talking about today. So if you want to jump in and comment 2, that will be sent your way. Our next question is, how can strong chewing habits in early childhood help reduce orthodontic issues later?
Yeah. Well, when we chew hard foods and we're using our muscles well, it really stimulates the jaw development, our palate development, as well as our jaws growing forward. And as our jaws grow better, we're going to have more room for all our teeth to fit. And, you know, obviously the jaws are the floor of our nose, the housing for the tongue, and the support for our collapsible throat or upper airway. And so it's not just the teeth, it's really getting everything to fit better for optimal breathing and sleep.
Yeah, no, definitely. And yeah, so all that force on the jaws and everything, that's really, yeah. I love how efficient you are in answering these questions too. Straight to the point. It's so good. Just
Yeah.
simple, digestible
But you know,
information.
we understand really from examining the skulls of previous
Mm,
populations how crowding has only become a more prevalent phenomenon
yeah,
in the last few years, coinciding with the Industrial Revolution. And actually with the increased processing of food, so we're not using our jaws as much. So that is one of the key factors that's been really behind this increased incidence of orthodontic problems.
yeah.
So that is the importance of chewing.
Mm, yeah, we don't chew. So we need to. I often get asked that, like when I'm working with Munchee or even just clinically with my clients, that, but why do we need something like the Munchee? Why are we just suddenly needing things like this? I'm like, well, it's not sudden, it's been around a long time. But 2, it's
Yeah.
just, yeah, we're not chewing enough in our diet, so we have to do extra things. Like we never used to have to go to the gym. We,
Yeah.
when we were primitive people, but that's now part of our lives. So a similar concept. But
Also, back to chewing, you know, we've had the introduction of pacifiers as well. So that is really altering the way that our mouth is working.
yeah,
Instead of that chewing, we're getting the inward pressures of the lips and cheeks and that altered swallowing. So this is contributing to orthodontic problems as well. So I do think that it has a really important role to counteract some of those habits and
yeah,
reintroduce proper stimulation of the muscles as well.
yeah, definitely. In your clinical work, what changes do you see when children start to use a Myo Munchee regularly?
Yeah, so many changes really.
Yeah.
I love that it promotes lip seal. Um, so just getting kids conscious and getting them more able to close their lips more. And often this will translate to more nasal breathing. And parents will often say that their child is sleeping better. Yesterday, I had a parent tell me through the munchie and just having more nasal breathing that their child last winter had less hospitalizations. So he was less sick. And I found that really rewarding, just such a simple intervention to actually practice closing your mouth and chewing correctly. And I think parents will notice that their child can manage more foods, they're sort of using their muscles more. And even some parents might say that their child's speech clarity has improved just from the chewing. So getting the muscles to work really well, I feel it's really foundational for all our other functions that we expect, whether it be speech and breathing and sleep. But personally, in my practice, I really love the munchie. I do a lot of orthodontic expansion, and I will actually introduce the munchie for every patient before I start. So I use a lot of removable devices, which are very compliance based. And I need children to wear it 24/7. And if they can't, and they're struggling with foods or struggling to chew, they're going to take it out, and the treatment is not going to be as effective, or we're going to have more emergency appointments. So I love using the munchie more and more. I am getting children to use it for 10 minutes before we even begin the treatment. And I think it stimulates the muscles, it gets children using them. It's such a struggle for some children to even have it in their mouth for 20 seconds at the start, but it's really gratifying to see them build up that 10 minutes and using their muscles really well. And it really starts the process of getting the muscles in better balance, because when we do orthodontic treatment and we don't address the root cause or oral dysfunction, there's going to be more relapse. So I'd rather have child work with the munchie. It's, it gets so many things working. It's a massive effort and coordination. And once I think a child can use the munchie, I think it desensitizes their whole mouth. Like our team knows when a child's used the munchie really well, they can get the photos in, do the retractors, the mirrors, everything becomes a lot easier. And I feel that children develop a better sense of proprioception. Like I can give a child an expander and they put it in their mouth, they know exactly where it all fits. And it just gets them swallowing better, disengaging all their muscles. So I have found that since doing that with the munchie, like you were asking what of the success stories, it's really having children that are more ready for treatment. They're coping better, transitioning better to eating and chewing with it. And post-expansion, the myofunctional therapy becomes a lot easier because they've already adopted quite a few different habits and awareness of their mouth.
I love that perspective too, because I think like as a myofunctional therapist, like that's what I do. And I often when my clients are on the wait list for a functional dentist to start expansion or or an ENT wait list, I often have that conversation. It's just a great starting, but it's nice to hear it from a dental professional to back that up. But yeah, it can just be a starting point of getting them used to something in their mouth. And often my role is that just I'll have kids that I can't even touch their lips of without such a significant gag. So all of this desensitization, and I find the munchie a great place to start. And lovely to hear that that's how you would use it too.
Like with the gagging reflex, with the success stories, one of my really memorable patients is a child that would her mum said she would throw up, like whenever she went to the dentist or when the depressed her tongue to have her tonsils looked at, she'd warn the doctor. The doctor wouldn't listen, and then she'd throw up all over the doctor. But I think through the myotherapy, through the Myo Munchee, she became less sensitive with it. And mum has just said, like, ever since she's gone to the dentist, she's not gagged with her x-rays. In fact, the last time they went away, everyone in the family got sick, but she was the one that didn't, when she was the one that normally had all the asthma and the sickness. So I think, there's a lot of value in it.
No, incredible. That's really great. Before we do wrap up, I thought I think there's a great amount of people asking for that resource. So if you do comment Chew, you'll get that in your inbox. But any quick questions for Shereen and I today before we jump off? Because I think we've covered our questions so beautifully, but just looking if there's any already. There was one about ages of Myo Munchee, like when they, till what age can they be used? I don't know if you've got a perspective on that, because obviously you work in that infancy side of things. So we're starting at, when would you recommend, what's the youngest patient you've used a Munchee with?
I've done 3-year-old, 3-month-old, sorry. But 5 to 6 months, I think, when a child is able to handle it. And I offer it to nearly every baby that is of that same age group, that I see, because I think those babies that I'm seeing, they've had a lot of oral dysfunction. They've had tongue tie and able to suck and swallow, and often I'm doing all these releases, and I think having the munchie, being able to use it, if a child can use it, whether or not they have the tongue tie, it's a good sign that things are functioning well. So I
Mm.
will introduce it to babies a lot of the time in 5 to 6 months. And I enjoy watching children. I think it's so good for them to be able to mouth and get all that sensory input inside their mouth. And
Yeah.
just the fact that they're able to close their mouth and keep it in without thrusting it out, it's a big
Mm.
win. And
Yeah.
they chew it, it just, knowing how much that does for them. I'll introduce it in babies and children. I'm less confident in adults, but I know the team is more involved with that. Yeah.
Yeah. Yeah. No, definitely. And I think the age we could use it up to is, you know, if Kevin Burke had anything to say,
Yeah.
who created it, he would say, until the day you pass away, because it's just incredible, especially as we age.
Yeah.
But we just had a bunch of questions flood through, so that's great. Any that we don't cover, because we only have a few more minutes, just I'll flick them through to the team and make sure that they get back to you with any of those sort of questions. Oh, oops, sorry, just grabbing any. Okay, so I have this. We'll do. There's two great ones I think we can do nice and quickly. So I have a 13-month-old who uses the munchie, but only for a few seconds at a time. Any suggestions to keep it in longer? I'd say consistency and persistence is
Yeah.
the one thing.
Parents fun and copying as
Mm,
well.
yeah.
And I would also, yes, like you said, just try it, don't push it. If they want it, let them have it, even if it's the handling. I'm quite happy with that until children build reduced sensitivity to it.
Mm,
And also, I would say just also making sure that they can breathe okay. So generally speaking, with the Myo Munchee, I like to know that if it's an older child, it's really easy. We do the lip seal test with a paddle pop, just making sure they can breathe okay for 3 minutes with their lip
mhm.
sealed, because obviously that will be an obstacle or a barrier to keeping it in the mouth as well.
Yeah. Yeah. No, wonderful. And this is quite specific to you, so I think we'll finish on this one. But how early do you start expansion, and how long would you use a Myo Munchee before starting another appliance?
Yeah.
Hard to timeline things with kids.
I I have started expansion in multiple 3.5-year-olds, but due to our busyness now, we sort of have lifted the intake to about 4 years. But even so, my preferred option, as long as there's no major functional issues, I prefer to do expansion around the age of 5.5 to 6 years when the
Mm,
permanent teeth come through. Because I do think that when children are a little bit younger, if we introduce intervention like the Myo Munchee, it really helps address those oral muscles. Um, and because they're so young, that can influence that trajectory of growth a little bit. And I'd
mm,
rather let nature do a little bit before I jumped in and do my expansion because it will be a more stable result. And I've seen fantastic results where, for instance, we have like 3 or 4-year-olds that have had massive pacifier use or thumb sucking, and they've used the munchie
yeah.
and structures normalized a little bit more. So I do think uh, if I can, I try to do expansion at 5.5 to 6 years.
Yeah.
Yeah.
No, wonderful. Well, I think there are some more questions coming through, but we will have to
Yeah.
pause. And
Thank
yeah,
you.
I think I just want to thank you so much for your time today. And yeah, if you have any questions, I'll make sure I get them through the team now. And yeah, thank you again. It was a
No,
great chat.
thanks, Kelsey.
Have a great day. See
Ta.
you later. Bye.